Good morning, everyone. Thank you for joining us today for Facebook Live. And it's really hot out there, and I think the heat impacted our technical equipment. That's why we're a few minutes behind. But here we are, and today I am joined by someone that you're very familiar with, Kayla Myers, who is our Immunization Assessment and Promotion Program Coordinator. It's a very long title, which basically means she takes care of lots of things. But the reason why we're here today is twofold. First, I want to share with you a little bit about the strategic planning process that the Spokane Regional Health District just went through. Most large organizations do that every so often. And we just completed what will be our 5-year vision, basically our 5-year strategic plan. And within the context of that, we have 4 very specific goals. And remember, strategic plans, you can have 17,000. You typically have 2, 3, or 4. And goal number 1 for us is to be visible and trusted in the community. Now, we are visible in the community, and we do hope that everybody sees us as a trusted source of information and access to information. But we want to make sure that over the next 5 years, we really focus on that as much as we can. And we thought that one of the ways to socialize that concept with you is share with you the activities of some of our programs that are visible in the community, that are trusted in the community, and that very actively engage with the community to protect, promote, and prevent, which is the reason why Kayla is here with us today. And I said twofold because August is National Immunization Awareness Month. So we're starting a little bit early, but just giving you a heads up. So welcome, Kayla. Thank you for joining us today, and thank you for tying what you do with our strategic goal number 1. First question. So I said your title, which is very long, but tell us, what does your team do, and how do they engage in the community, and how are you and the team visible, and how do you know that people trust you?
Ooh, that's a lot. All right, so our program, we coordinate and collaborate with external and internal partners. So we do that by developing education materials or providing access to vaccines or giving educational events or presentations to various communities. So we just try to be out there. We try to be the logo you think of when you have a vaccine question. So, but yeah, our amazing internal programs like the health equity team and our communications team are extremely important in us getting our program out there.
So you mentioned a lot of activities, a lot of venues, a lot of events, and I'm sure that if you pay attention, I'm sure people have seen you and have seen the team. Hopefully they came by and said hello and checked out what information you have. But the reality of the matter is not everybody feels comfortable about immunizations. Not everybody may have as much information as we need them to have to make whatever the best decision for themselves and their children, because we focus a lot on children too. So what does it take for us to be able to provide as much information, knowledge, and access for someone to actually feel comfortable with immunizations in general?
I think it's first more important to listen to what their concerns are, so we can have an idea of what we think is maybe the problem or what they are, like whatever they've read, but it's more important to hear their concerns so that we can learn where to meet them at, or maybe it's a specific resource or a story or dis or misinformation that we know is circulating, and then it helps us kind of target that specific concern or myth so that we can maybe help people feel more confident in what they do or in their decision. I think it's also important to remember part of building trust is really hearing what the person is saying. So you can listen, but if you don't actually hear it, and I think the most important thing for people to know, or maybe a concept that I'm learning to grasp, is that if you want vaccines or if you don't want vaccines, generally it comes down to the same thought, is that they want to be safe. they want to keep their children safe, right? So as long as we can recognize that that's the common ground and start from there, I think we make a lot more progress. And it's just being consistent and showing up consistently, having the same conversations consistently, and just willing to have those conversations over and over again.
Right. So you mentioned a couple of key concepts. First of all is listening. We do listen. We do want to learn. We do want to know. We don't presume that we know everything, because we don't. So we're always happy to learn. But we are not here to tell you what to do either. Our goal is to share with everyone in the community as much information, as much access to knowledge as we have. So then the individual community members can make the best decisions for themselves and their families. And we always encourage everyone, if you have questions that are more specific to you or a member of your family, make sure you check with your provider, because they have information that may be relevant to the decision. Now, Spokane is, we have fairly diverse population, multiple backgrounds, multiple languages, multiple faith-based organizations, a lot of diversity in terms of people. So how do we go about, and you mentioned we try to meet you where you are, how do we go about making sure that we're reaching people where they are, regardless of their background or their language, and how do we support those efforts?
So great examples of this are, we are only able to really get the cultural responsive materials developed because of our community workers and our equity program, but also in engaging with other communities, such as those experiencing homelessness or substance use disorders. So it's really about having the relationships within the actual community so that we can hear the information circulating, because not every community believes the same things about vaccines. So a good example is working with our communications department recently. There was a cute ad that talked about she thinks mumps is jumps, but when we translated it to another language, it did not make sense. No. And it wasn't going to resonate. So we were very lucky to have people who have English as their second language that work here to be able to review those translations and make sure that our intent is getting across as well. Right. So it's not just about meeting them where they're at or making up an ad. It's about, are they going to resonate? Is it going to resonate with them? So we kind of dive into deeper layers to make sure that it's not falling on deaf ears.
Wonderful. So you mentioned a couple of things there, like accuracy of message, consistency of message. We try to be very consistent. And as Kayla mentioned, we do have resources to make sure that whatever we say, because literal translations are not necessarily 100%. Yes. You always have to make sure that you're utilizing the appropriate approach to get the message to be accurate and consistent. So tell us, as you've been out, and since I've known you, I've seen you in a lot of activities, any time in the recent past where your presence, you feel, made someone feel safer out in the community?
I feel fortunate to be in disease prevention because it seems like I do get that opportunity a lot. I was thinking about it, and I've been here 10 years, wow. And I've experienced a few outbreaks, and so at every outbreak, of course, people are happy that we're there helping, mitigating cases, trying to slow the spread, right? So it always feels good to know that that's my impact, or our team's impact. And most recently, of course, is COVID. So when the first few doses rolled out and we were trying to get the first responders covered so that they could respond to emergencies, and then all the healthcare workers, and then going into those tiered phases. I know some people had issues or were upset that they weren't getting it, but the people that were getting it were extremely grateful. And that is something that I hope we never see again at that level, but it was very rewarding.
Well, I'm glad to hear that. And we're present in the community. We're here to collaborate. We're here to partner. We're here to really enhance what the community can do together to protect all of us. So talking about collaborations, and I know that we have some very specific ones with, for example, schools and clinics and others. So how do we stay in touch? How do we stay active? How do we stay engaged? Because I agree with you, we don't want to see another pandemic, but if there's something else, we want to make sure that we're always engaged. How do we do that?
Yeah, so part of disease prevention, right, is always making sure that we can respond. So we try to maintain the partnerships that you listed out. I think one way my program does it is we try to attend the school nurse meetings regularly throughout the school year. You have a great relationship with the superintendents that helps us get time with them if we need that. And that helps us just kind of provide the landscape of what to expect for the school year based on the coverage rates, right? So also something we do for schools is we offer to do school-based clinics.
Right.
And so this year and every year we try to do the Shaw Middle School Clinic, and it's a back-to-school vaccine clinic. It's our largest one, and that one will be August 27th this year from 3 to 6 p.m. And then we also collaborate with our community partners, such as like the Salvation Army, and they do their backpack event, which is on August 13th, and we'll be there from 10 to 1 p.m. to hopefully provide convenience of vaccination services for those families as well. Other venues, so we're constantly in the shelters, trying to make sure that we're getting people who maybe don't have insurance or don't have a provider, or maybe they're just passing through, get them up to date on anything that they might need as well. What was the other third one you said?
In general, other community partners.
Yeah.
I know we focus a lot on education, but that's because we do have a very solid partnership with education, pre-K, K through 12, and higher education at all levels. But I know that we partner and collaborate with a lot of other organizations. You mentioned a couple. Anything else that comes to mind that you want to highlight?
Yes, so we have some amazing mobile vaccination partners, and they've created a network where if it's maybe we get a vaccine or a clinic request that is for a population that our vaccine isn't funded for, meaning uninsured adults is the only one that can get our adult vaccine, for an example. And so then we have a network of partners that we can ask to cover that clinic request, and they have the ability to bill insurance. So it's nice to have options to pass along, because there is a need, that's why they're requesting the clinic, but maybe we don't have the funds to provide that vaccine. So that's something that has developed over the pandemic and has been maintained and has been going really well.
Wonderful. So a couple of things that you mentioned I just want to highlight. And if you recall, when we started, we said visible and trusted. I think there's a lot of examples there of highly visible. I think there are a lot of examples there of highly trusted. But we've also underscored a lot collaboration and participation and engagement, because it's not about like you and I individually can do, it's about what we can do. And we is not only the team here, but many times is we in the community with all of our partners. As you mentioned, we don't have access to everything or everybody, but with our partners, we certainly cover a lot of ground. So I wanted to say thank you to all of our community partners. We mentioned a few of them, K through 12, higher education, pre-K, but we also have a lot of other partners in healthcare, in many of the organizations in town, many of the nonprofits, as well as partners with the administrative leadership of the community. So we do work with a lot of people, and that is not only how we remain engaged, visible, but also how we build the trust, because we're there to listen, to learn, and to participate to the extent that we can. Any message for the National Immunization Awareness Month that is coming up in, you mentioned a clinic. You may want to highlight that again in case people were not listening to that. It's on August the 14th, right?
We will be at the backpack event at Salvation Army on August 13th from 10 a.m. to 1 p.m. And then we will be the ones hosting the clinic at Shaw Middle School on August 27th from 3 to 6 p.m. So we hope that provides access for families that maybe weren't able to get into the doctor's office during the summer and get their kids covered with the vaccines needed for school. And we just really enjoy doing those events.
Wonderful. So scratch the 14th. It wasn't the 14th. It's 13th and the 27th, right?
Yes.
Okay, good. I just want to make sure we all have
Wonderful.
the right dates. So with that, I'm going to say thank you to Kayla. I also want to highlight that as we went through our strategic planning process, we did have a number of community partners that participated and helped us determine how do we move forward for the next 5 years with the greatest impact possible in the community. So I wanted to say thank you to all of them because a lot of people may not know how that process works. So with that, I'm going to say again, thank you. Don't forget to watch out for the events that Kayla mentioned. I know back to school is going to be around the corner at some point in time. Immunizations are important. Make sure you're talking to your provider, check with your school. You can go to our website. I think we flashed our website a couple of times as we were talking. A lot of the information that you need is right there. And if you can't find it, you can contact us and we'll be happy to either provide you the information or direct you to the appropriate source and resource. So Kayla, thank you very much for coming. I didn't realize you were here for 10 years because I only have like 5 years of vision, but I wasn't here before. But I know that you're one of the first people I worked with when I joined the district, and I remember all those deployments, and it was interesting, and everybody did a great job. Don't really want to go through it again. So with that, stay safe, stay well, and we will see you again next week. And thank you for joining us today. Thank you, Kayla, and thank you to the team upstairs. Have a great day. Bye.